Strong antibiotic sitting behind the counter in Mexico. That same drug locked behind a prescription wall in Germany. The rules governing what you can and can't access without a doctor vary so wildly by country that expats who don't learn them before they're sick end up either dangerously under-medicated or completely blindsided. This is the Second Homeland, our series on building a life abroad. And if you've been following along, you know we always talk about systems over scrambling. Healthcare is where that philosophy matters most. Let's start with the thing nobody wants to think about until it's urgent. Finding a doctor. When you first arrive in a new country, your instinct might be to wait until you actually get sick before worrying about this. That's completely understandable. You've got a million other things to set up. But here's the reality. Finding a good doctor when you're healthy is a completely different experience than finding one when you're running a 102-degree fever or dealing with something that actually scares you. So your first week or two in a new place, you want to actively research local physicians. Start with expat communities, whether that's Facebook groups, Reddit threads, or local forums specific to your city. Ask who people use. Ask who they trust. Ask who speaks English if that matters to you. Real recommendations from people living your situation are worth far more than any online directory. You're specifically looking for a few things when evaluating a potential doctor. Do they have experience with expat or international patients? How accessible are they? Meaning, can you actually get an appointment within a reasonable time frame? Is there a language barrier? And if so, how significant is it? And critically, what's the payment process? Do they work directly with insurance? Or is it an out-of-pocket situation where you submit for reimbursement afterward? Some countries have tiered healthcare systems where you'll be navigating between public and private options. Private clinics will often be more accessible and English-friendly but cost more. Public systems may be excellent quality, but require more legwork to access as a foreigner. Understanding which category applies to where you're living changes your strategy completely. Now let's talk about pharmacies, because this is genuinely one of the most practically important things to figure out early on. The first thing that surprises most expats is how dramatically different over-the-counter access varies by country. Something you've bought off a drugstore shelf your entire life back home might require a prescription where you're living now. The reverse is also true, and this actually works in your favor. Medications that are tightly controlled or prescription only in places like the United States are often available directly over the counter in parts of Europe, Latin America, and Southeast Asia. This means your local pharmacist becomes a genuinely important healthcare resource, not just someone who hands you a bag. In many countries, pharmacists have real clinical training and are comfortable giving advice for minor ailments. If you have a mild infection, a skin issue, or common symptoms, walking into a pharmacy and describing what's happening can get you real help quickly without scheduling a doctor visit. Build a relationship with a pharmacy near your home. Go in, introduce yourself, explain that you're new to the area. Ask about what's available over the counter and how their system works. This simple step will save you enormous confusion later. On the topic of medications you take regularly, this needs immediate attention when you move abroad. Do not wait until you're down to your last week of a prescription medication before figuring this out. The process of getting a foreign prescription recognized, getting a local doctor to evaluate you and write a new one, or finding out your specific medication isn't even available in your new country. That process takes time you won't have if you're already out. Start this research before you move if possible. Figure out whether your medication is available locally, what it's called, brand names differ internationally, and what documentation you'll need to bring from your current doctor. Many expats find it useful to get a letter from their physician at home, detailing their diagnoses, current medications with generic names and dosages, and general medical history. This document becomes a powerful tool when establishing care in a new place. Now, insurance. This is where the most complexity lies and where the most expensive mistakes happen. There is a massive difference between domestic health insurance and international health insurance, and many people don't discover that difference until they're sitting in a foreign hospital trying to figure out who's paying for what. Standard policies from your home country frequently do not cover you abroad, or they cover emergency situations only with significant limitations. International health insurance is designed specifically for people living outside their home country. These plans vary dramatically in cost and coverage, so you need to read the actual policy details, not just the marketing summary. Key questions to ask. Does the plan cover pre-existing conditions? What's the coverage limit? Is there direct billing available with hospitals in your area, or do you pay and submit claims? Are prescription medications covered? What about dental and vision? And perhaps most importantly, what is the evacuation coverage if you need to be transported to another country for treatment? Some expats in countries with strong, affordable public or private healthcare systems choose to go without international insurance and simply pay out of pocket, sometimes combined with a travel insurance policy for emergency coverage. Whether this makes sense depends entirely on where you're living, your age, your health situation, and your financial cushion. It's a valid approach in some contexts, but a genuinely risky one in others. One framework that works well is what I call the 3-layer healthcare system for expats. Layer 1 is your local pharmacy and pharmacist for minor, everyday health stuff. Layer 2 is your established local doctor for anything that needs professional evaluation and isn't an emergency. Layer 3 is your insurance and the hospital system it connects you to for anything serious. When you have all 3 layers set up and you understand how to access each one, you're operating from a place of genuine security rather than hope. Before any of this becomes useful, you need to build a simple healthcare document. This is just a 1 or 2 page summary you keep accessible that includes your blood type, known allergies, current medications with generic names and dosages, any significant medical history, your local doctor's contact information, your insurance policy number and emergency contact line, and the nearest hospital to your home. Put this somewhere you can access it quickly. Share it with a trusted person in your life, and update it whenever something changes. This document sounds basic, and it is basic. But in an emergency, when you're not thinking clearly, or when someone else has to advocate for you, this document does serious work. Here's the psychological piece that ties all of this together. When you know your healthcare layer is established, something shifts in how you experience daily life abroad. You stop carrying that low-level anxiety that hums in the background when you know you're unprepared. You can focus on actually enjoying where you are, because you know that if something goes wrong, you have a plan. That sense of groundedness is one of the most underrated parts of building a successful life overseas. The expats who thrive long-term aren't the ones who never face health challenges. Everyone faces health challenges. They're the ones who built their systems in advance so those challenges become manageable moments rather than defining crises. So this week, take one concrete action. Whether that's researching local doctors, visiting the pharmacy near your home, reviewing your insurance situation, or building that simple healthcare document. Pick one and do it.